Hello and welcome to Jammu Links in Conversation series. Finding a good doctor is a blessing in today's time. Our guest of today is not only a good doctor but a renowned and a respected eye surgeon of Jammu, a gold medalist from ICRS. For his remarkable and recommendable work, he is an advisor to many eye care centers, not only in India but abroad also. Here's the icon himself. Welcome to the show, sir.
Thank you.
So, growing up, you always wanted to be a doctor?
Yeah, right from day one.
Oh, really?
I always inspired to become a doctor. And then when I was doing my graduation, at that time I had decided to become an eye specialist.
So, sir, why specialize in eye care only?
I just felt that this is the right branch for me, and I had a great interest in of all the subjects. If you see the subjects, we have so many subjects in MBBS.
Okay.
I had a liking for the ophthalmology, the eye. My dad was a doctor, definitely was a doctor. He was in the army.
Okay.
But I lost him when I was just in the first year of MBBS.
Okay.
But then it was always there a feeling that no, I should also become a doctor.
So, you just said your dad was in army. You were moving a lot. Does it also influence your decision?
There are a lot of movements wherever he used to be posted, we used to be there. And whenever he used to go to the hospital, because he was a physician,
Okay.
and he was not a surgeon, so I used to accompany him at most of the times there, and that's how I really developed a liking to be in this kind of a profession.
So, you said you inherited the love for being in this profession from your parents. Would you mind if your children also take up the same profession?
Well, my son is doing his master's in surgery.
Okay.
And he is a doctor and he is doing masters in surgery.
So, you performed your first implant surgery in 1987. Surely the techniques have changed since then. How do you feel about the same?
I have kept myself updated and doing all the surgeries which are taking place all over the world. Today, whatever surgery is being done worldwide, as far as cataracts are concerned, as far as spectacle removal surgeries are concerned, I am doing it.
Do you even see any change or in regards to attitude of patients?
They are more demanding.
They
are more demanding. Earlier things were not that this thing that you could manage, but now you have to be precise and accurate with each and everything, for which I have acquired equipments which Jammu ophthalmic branches do not have. For example, we have an image guided system. Whenever I do a cataract surgery, it falls on the image falls as to where I have to give what incision, where I have to give. If I have to put a toric lens, a cylindrical power, I can remove the cylindrical power totally. So we have all those lenses, and this is all done with the image guided system, which is not at all available in the whole state of J&K.
Doctor of your caliber could have been easily settled in abroad, doing very well for himself. What keeps you going in Jammu?
I don't know, but somehow or the other I love this place, and I love the people.
Jammu really does not have a very good reputation as far as medical health is concerned. And for eye care also, people often resort to places like Amritsar. So, how do you see it changing in Jammu, or how do you place your eye center in this scenario?
Well, yes, you are right, because a lot of people about 6-7 years back or 10 years back used to move off to Pathankot and areas like Amritsar. But since we have come up with things which they are probably they are lacking in what I am doing. So it's going to take another year or 2 years, and you will find that I am pretty confident on that another 2 years people will say no need to go, and people are saying at the moment that no need to go to Amritsar, why don't you show it to R.D.Sood?
Okay.
And so that he can treat you well, because I have each and every facility as far as ophthalmology is concerned.
Talking about medical facilities, do you think that this scenario will change if AIMS, which is supposedly to be set up in Jammu?
You see, having the facilities and having doctors are two different things. You may have the best of equipment, but if you do not have the doctors to run the equipment, and to give results with the equipment, it's no good, no idea. So you really require great consultants, surgeons who can do the best, and that is how I personally feel that just having an infrastructure or just having equipments does not help. You have to have a consultant who has to have the brains and who can treat the patient in the right manner.
So your wife is also a dermatologist, and being a doctor often ends up in having busy schedules. So how do you find time for each other?
Well, it's a very personal question, but I don't get much time with her, and I'm really very sorry for that. And but I don't have much time for her. We probably meet in the morning when she goes off for her job, and probably I see her again back at about 8 o'clock, 8:30 when I finish off my clinic. I'm not able to give her the time, and I really am very apologetic to my wife.
So being a doctor couple, was it hard on the children while they were growing up?
I think that time I had time, and I could easily give a lot of time to my son and my wife. But now in this thing, because of the advancements and everything has to be managed, planned out. If I have a surgery, the next day everything is planned out a day prior as to how I have to go about with the surgery, how to give the perfect results to the patient.
So sir, what do you love beside your profession? How do you unwind yourself?
Whenever I get time out, I love traveling. I have traveled a lot abroad, not only for the conferences but for my leisure trips. And I feel that traveling gives me a lot of relaxation and total enjoyment, and that is the time I get with my family to be with them and to have a great time.
So you were associated with Center for Sight for a while, but the association no longer exists. Any specific reason for the same?
I thought that, you see, there were a lot of points where we did not click with each other, and probably one was the monetary reasons. We were doing services, we had the equipment, because the Center for Sight, the equipments were all mine.
Okay.
I had taken those equipments, and it was just a name that was given, that Center for Sight is in Jammu, because they asked me that they probably aimed on to me or zeroed on to me after going through with all the other doctors, and they said, no, we want you at whatever price you feel you can come in. And but then I thought I should do it on my own, and I should, why not have my own name coming through than having a Center for Sight associated with Sood Eye Center. So I thought to dissociate with them last December 14.
So we often see that patients do a lot of self-medication. What's your advice to them? And also we see a lot of children wearing spectacles these days. Any specific advice you'd like to give to the parents out there?
Well, I would advise that one is that every child, before going into school, or in fact the school should make a system in which before they go in for taking the admission there, they should get an eye examination done. At least that will help sort out a lot of refractive errors if there are, because if you do not give the number to the patient has a poor eyesight, the patient goes into a state of amblyopia, where then improvement cannot be done even at a later stage when detected. So one is that before going into schools, they should have a system whereupon an eye checkup should be a must. Second thing, for my elderly patients and for the middle age groups around 40-45, they should always get an eyesight checkup done, and more so if they are suffering from diabetes, because diabetes is, it's going to be India is going to be a world capital of diabetes very soon, and a lot of patients we have who have diabetes, and they come to us, they think that it is probably the cataract which is coming and causing a loss of or a diminution of vision, but it is the retina that is affected, and affected so badly, because whatever effect the diabetes causes on the retina is irreversible. Only thing is that I can, by virtue of some lasers and by certain injections, I can only help the patient in not losing further vision. But if you come late to me, you've almost lost a lot of vision. And of course, then by the elderly people, the cataracts tend to develop, so that we are able to distinguish what a cataract is and what a glaucoma is. Glaucoma is a kala motia and a cataract is a safed motia. So what actually happens is that in both the cases the vision loss takes place. A lot of people think that this vision loss is not because of the cataract, but if they get it checked and we check the eye pressure of the patient, we sometimes find that it is the glaucoma which is causing this vision loss. And if they come at a later stage, because in glaucoma whatever vision loss has taken place, I cannot bring it back. I can only stop the further progression of the visual loss. And if the patient is coming to me with glaucoma, or he has been detected glaucoma at a later stage, that means he's lost almost 80%, and even doing a surgery or with medication, I cannot bring his vision back. So it's a very important thing that after the age of 40-45, each and every individual should go in for a eye checkup once in a year. And for a patient who is diabetic or has a family history of diabetes, should get a checkup done every 6 monthly. And of course, there are a lot of other factors like children sitting only on the smartphones or on and doing texting and playing games, or sitting and playing video games. One's advice to my patients is that when you sit for a video game, or the parents who make their children sit on the video game, and they should have a long cord, or they should have a wireless system which should make them sit at least 10 feet away from the television. And you should always watch a TV 10 feet away, whether be it an adult or be it a child. 10 feet is the distance to watch a TV, not closer than that.
Sir, any message or eye care tips you'd like to share with the Jammu Links News viewers?
Well, patients who go on motorbikes or who are the scooty girls, they should always wear a helmet which has a glass there in front, so that wind or the breeze does not hit their eyes directly, because they can suffer from dryness. Second thing, patients who are on the computers, they should blink voluntarily. One is an involuntary blinking, which we always normally do, but when you are sitting on the computer, you must do a voluntary blinking, so that the fluid tends to spread on the eye and helps the patient not getting a dry eye. And do not keep always staring towards the screen of the computer or the laptop or whatever you are using. You should always, after about 10 or 15 minutes of use, you should always look here and there and come back. And of course, there is a neck strain which you get for computers. Always you should do some kind of a stretch exercise of your neck when you are on the computer for a while.
Thank you, sir. It was a privilege having a chat with you. It was really a wonderful experience. Thank you.
Most welcome, most welcome. Thanks a lot.
Thank you, viewers, for being with us. Keep watching this series for personalities from Jammu and Kashmir. Keep watching Jammu Links in Conversation series. Thank you.